Good morning. My name is Melinda Kavanaugh, and I'm an associate professor in social work at the University of Wisconsin-Milwaukee. And I'm thrilled to give a very brief presentation of our project with UWM, the United Community Center, and the Alzheimer's Association. This is preliminary data, first data out of a very large project looking at identifying early warning signs in Alzheimer's and related dementia in both the Latino and the African American community. So this was a project that was born out of a longstanding collaboration with the United Community Center and the Latino Aging Consortium. And what we sought to do is really try to figure out how families, or are families, able to identify early warning signs in Alzheimer's and related dementia. Second of all, we are excited to be able to add in not only adult family caregivers, but children and youth caregivers, because we know that they spend a large amount of time with their family member, but they don't get engaged and included when we ask about the care experience. So we sought to interview both adults and children about their caregiving experience, but specifically trying to understand how and why it is that families make that transition to formal care. We know in the Latino and African American communities that transition to formal care tends to happen later than it does in the predominant white community. We also have very little information on what precedes that. We know that there are some crises that can happen, something large that really triggers that transition. But what happens earlier, those early warning signs, are they catching them? Are they able to perceive them? And if so, how can we build and develop and really target interventions at those early warning signs? We also interviewed healthcare providers about their perceptions of early warning signs, as well as, do they think family caregivers can identify those early warning signs? So our data is quite large. We have lots of information on the crises and the transition to formal care. But what I'm presenting right now is a brief synopsis of some of those early warning signs. So in a sample of 36 adults and 31 youth and 26 healthcare providers, what we found is that across groups, the adults and the youth are truly able to identify some of those earliest signs. And these are families who actually had made the transition to formal care. So in asking them to look back and say, what is it that helped them or that they were able to identify in order to get to that formal care, really helps us understand how to develop an intervention. So those early warning signs are physical. They were definitely emotional, identifying some changes in their personality, some slight irritability, some potential for some slight depression, and then also very practical things like cooking and leaving things on the stove. And what was very interesting is that there was a difference between how the adults and the children perceived those early warning signs. The children found humor in it and wanted to figure out how they could help their grandparent, whereas the adults found real frustration and described some anxiety, and also described the fact that they knew that meant that they were going to be involved in care. What was also interesting is that the healthcare providers, while they said they could identify what an early warning sign might be, they didn't think that families could. And that isn't that they thought the families were less able to do it or lack of interest. They just thought that it's too sensitive to catch those early warning signs. So what we are making a real point on, and what we're very excited, is that families can identify those early warning signs, and that interventions really can be built at a very early age to help reduce the possibility of crises and get families engaged in formal care at a much earlier stage. So thank you so much for your time. I'm very excited to present this data. We have an amazing team, and I look forward to any questions or comments in the future. Thank you so much.